Hi, my name is Andy, and I'm a nurse at Dr. Genevieve's Surgical Center. Today, I'm going to give a brief overview of what you can expect after an abdominoplasty and general postoperative instructions. Depending on your specific needs, Dr. Genevieve will prescribe a number of medications to take at home. There will be 2 medications that need to be taken on a schedule. The first medication is the pain medication. Typically, the pain medications are taken every 4 to 6 hours. Your first dose will be given at our ambulatory surgical center, and the discharging nurse will tell you what time your second dose should be taken. It is very important to maintain this schedule. If you wait until you're in pain to take the medication, it will be harder to keep pain adequately controlled. The second medication that will be taken on the schedule is your antibiotic. The first dose should be taken the night of surgery. Your antibiotic should be taken twice daily until the bottle is empty. If you have any issues with sleeping or with nausea, Dr. Genevieve will prescribe medications to assist you. The sleep medication should not be taken until 24 hours after your surgery. It should also be spaced out at least 2 hours from your pain medication. You should not operate a vehicle until you can tolerate pain without your prescribed pain medication. Recovery should not be taken lightly. Make sure your caregiver stays with you a minimum of 24 hours after your surgery. It is important to get up and walk around after your surgery, a minimum of every 2 hours. Be sure to rotate ankles and pump your feet every hour to get your blood circulating. After your abdominoplasty, it is important to keep in a flexed position to prevent from pulling on your incision. You will walk slightly hunched over for 2 weeks. You want to lie on your back with a pillow under your knees. You will have 2 drains and 1 pain ball. The pain ball has pain medication being delivered directly to your abdomen. The night of your surgery, you will stay at a hotel or hospital with a nurse. The nurse will reinforce your dressings as needed with maxi pads or ABD pads that look like this. You will have an abdominal binder that you need to wear. It will be secured around your abdomen, like this. You will wear your abdominal binder as a compression until your 1-week appointment. At your 1-week appointment, you will be sized for a compression garment. Your compression garment will look like this. Your clinical coordinator will help size you and demonstrate how to properly wear your individualized garment. You will have 2 drains to your abdomen. They look like this. You must empty them every 4 to 6 hours or when they are full. This is how you empty it. The pressure is locked in by plugging this. So you will pull the plug out, empty this into a cup, and then put it back in to maintain pressure and adequate drainage. The nurse will provide you with a drain lock and instructions on how to empty and care for your drains. This is a pain ball. It will be continuously placing a numbing agent into your abdomen for 24 to 36 hours. Once it is empty, it looks like this. At this time, you can gently pull on the 2 tubes from your abdomen. There are not any sutures to be removed, and this should not be painful. Properly dispose of the pain ball when you are finished. You will have these bandages and tape on your abdomen and any other areas where you have liposuction. It is normal for you to have oozing from the liposuction. If you see that the bandages are saturated, you may reinforce by placing an additional maxi pad or ABD pads like this on the outside of your bandages. The day after your surgery, you can remove the dressings and replace them with large maxi pads that look similar to the bandages that we have. Replace them as necessary. Keep your incisions covered for a minimum of 2 weeks. These are steri strips. You will have them on the incision line of your abdominoplasty. Do not pull them off. They will fall off on their own over the first few weeks after surgery. Do not do any strenuous activities such as working out or lifting anything over 10 pounds. No swimming or exercising for up to 6 weeks. Do not do anything that will raise your blood pressure. Avoid alcohol, aspirin, and ibuprofen after surgery. You will return to the office 1 week after your surgery to be assessed. Be sure you bring your completed drain log with you to your appointments. Dr. Genevieve will assess your drainage, and your first drain may be removed at that time. If you have any questions or concerns, or if you develop a fever of over 101.5, foul odor, or a sudden increase in drainage, please call our 24-hour line at 210-270-8595.